Good afternoon. How are you? How was your how was your weekend? Did you have a good weekend? Type in, tell me what you did this weekend. Where'd you go? Did you get your Christmas shopping finished? Your holiday shopping? So just waiting for some people to jump on here. Sometimes it takes a little time before people get their notifications, but if you're just going to watch this, let's just go ahead and try and jump in because many of you are going to watch this later. We're going to talk about diabetic neuropathy, peripheral neuropathy for a few minutes. Is this important to anybody here? Anybody have diabetic leg pain, neuropathy? So normally it's one of the complications of diabetes, right? So you get nerve damage, you get the nerves in your feet and legs and your extremities like your hands and up into your forearms. Sometimes if it gets bad, those nerves get damaged. And the reason they get damaged is because the small little blood vessels, I'm going to show you this. So you have a nerve, right? So you have this nerve here, and you have the little blood vessels, the microcapillaries around it. And what happens is insulin is very inflammatory, right? So insulin by itself increases inflammation when, especially in type 2 diabetes, one of the things that happens is we get insulin resistant. Insulin piles up in your bloodstream, creates inflammation in those little blood vessels, and those little blood vessels get destroyed over time. And if they get destroyed, what happens is the nerve, as you can see, this nerve doesn't look as healthy. And then we eventually get a nerve that's dead, right? So we get a nerve that is dying because it's not being fed. So if we have a nerve that's not being fed, it's going to die. It's just like taking a rubber band and putting it around your finger. If I do that and I tie it tight enough, we're going to reduce the blood flow to my finger, and the tissues in my finger are going to die. So that happens with the nerves. And one of the reasons it happens so easily with the nerves and we get so many problems with the nerves is because the nerves are so energy dependent. They require such high levels of oxygen and such and so much, they use so much of our energy that if we don't have a blood vessel to deliver the nutrients to the nerve itself, the nerve will die rather rapidly. Your brain and all your nerves actually make up about 2 to 3% of your body weight, and they consume close to 30% of all the energy. And if we don't have blood flow to get the energy there, then the nerves are going to die. So a lot of times it starts off as like tingling and burning, and then sometimes a loss of sensation, like people are wearing a pair of socks or like a thin stocking or a glove or something on their feet. It can pretty rapidly, in some cases, progress to just completely have no feeling. It can be extremely painful. And the thing is that what is offered is, if you go to your neurologist or something, or your primary care doctor, what is going to be offered to you is typically at this point going to be Lyrica. All right, for if you have diabetes and they believe that neuropathy is from diabetes, the typical offering is going to be Lyrica. May also be gabapentin or Neurontin. You've heard me talk about those in the past, but at this point, Lyrica is going to be the go-to for peripheral neuropathy related to diabetes. So if we're taking Lyrica, that comes with a price. Many of you commented on, I think there's 2.8 million views on the gabapentin video that I did. Wasn't expecting that. And many of you commented on that about the different side effects that you have. But here's some side effects of Lyrica. Pardon me. A high incidence of hemangiosarcoma, it's a cancer of the blood vessels. That's a side effect. It raises your creatinine kinase, which can contribute to kidney disease. That's a side effect. Lowers your platelet count, which can affect your clotting and healing. So that's a side effect. Your EKG can change, which means you're having heart damage. Like heart block. It can cause weight gain. Many of you commented that you started taking these medications like gabapentin, Neurontin, and Lyrica and gained tons of weight. It can cause weight gain. The exact opposite of what a diabetic needs to do. So swelling of the ankles is a side effect. Life-threatening angioedema can be caused by Lyrica. Swelling of your throat and face. That can inhibit breathing. So that can be a side effect of Lyrica. I'm not here to take you off your Lyrica, by the way. I can't do that over the internet. You can blow me up if you want to. I'm not here to take away your Lyrica. If I had my way, the FDA would never have approved it in the first place because of all the side effects. And I know that some of you will be upset that I said that as well. And that is your right. I'm just telling you all these side effects and what these medications do. I'm not a fan. It can also cause retinal atrophy. corneal inflammation and calcification, which can lead to blindness over time, so macular degeneration. So these are things that a diabetic are trying to avoid, okay? So if a diabetic is trying to avoid macular degeneration, or they're trying to avoid swelling, if they're trying to avoid the things that we're talking about, why would we give them a medication that causes those exact things? Now, a lot of you are going to say, great, what do I do to avoid the diabetic neuropathy? What do I do to avoid the pain? Well, one of the things you have to know is that your blood vessels can actually heal. So this is a kind of little thing called angiogenesis. Angio meaning blood, or vessels, genesis meaning generate. So angiogenesis would be like growing a blood vessel to be more like making more roots, right? So that's obviously going to do a better job of delivering nutrients than this situation at the bottom there, right? What do you need to do to make that happen? All right, I'm going to give you some things right now you can do. So this is, and by the way, there's an overwhelming amount of research in this by just unbelievable scientists and physicians that are looking for the cause. The research on this is outstanding, and it's not a small amount of research either. There's just tons of it. You're just not hearing about it because it doesn't sell drugs, right? So what do you want to do? You want to supplement, right? You need to have to provide your body with some supplements that will help create some new blood vessels. So alpha lipoic acid, vitamin E, acetyl L-carnitine. These are things that actually have been shown in research to help reverse diabetic peripheral neuropathy. So those are the things that you can do, right? Those are some of the things. Now, nerves are very energy dependent, as I mentioned. They have lots of mitochondria in them. They need lots of oxygen. So one of the things that you want to do is you want to increase, pardon me, your nitric oxide levels. Okay, so nitric oxide is well, you want to create your ability to handle nitric oxide. So hi Laura, hi Lisa. Carrie Chastain, she's one of our awesome staff. She's watching right now. So we want to increase nitric oxide levels. Now there's three kinds of nitric oxide. There is endothelial nitric oxide, which is extremely beneficial for your blood vessels. We need that, right? You need endothelial nitric oxide for those blood vessels. You're going to need neuronal nitric oxide. Neuronal is very good for your nerves, right? So they help. Nitric oxide helps those nerves get the energy and function the way they're supposed to. Same with your blood vessels, keeps inflammation levels down in your blood vessels. We want to avoid what's called inducible nitric oxide. Inducible nitric oxide, it gets elevated when there's inflammation. So as you've heard me talk about before, we need to avoid inflammation from foods in our diet. We want to reduce those all those processed foods, grains. The majority of grains we want to avoid. Some of you, especially if you're diabetic, like type 1 diabetic, you want to avoid dairy. That's a lot of molecular mimicry for dairy regarding some of the cells in your pancreas, subject for another day. But you want to avoid foods that cause inflammation in your body. We want to reduce inflammation as much as possible. We want to increase those endothelial and the neuronal nitric oxide. So how do you do that? Well, there's supplements that can help you do that. And I'm not going to give you a list of them now, but the first thing you should do is you go on to Amazon right now and get a little bottle, it's about this big, of nitric oxide test strips. So you can determine, are you deficient in these beneficial nitric oxide? So that's one thing you can do to help that angiogenesis, the rebuilding of those blood vessels to those nerves, all right? The other things, as I mentioned, were the acetyl L-carnitine. We wanted the vitamin E. We need lots of B vitamins, right? B1 through B6, B9, B12, lots of B vitamins. Your nerves use up so much of your B vitamins. And many people will become deficient in these things as they grow older because of the way their stomach works. And even due to some autoimmune issues, you want to increase your B vitamins and make sure you're utilizing those well. We talked about alpha lipoic acid. Now, some of the other things I want to let you know that can increase angiogenesis are using red light therapy, all right? So this is just a little device. You can get these on the internet. Some of them are better than others, but you see there's kind of different colors to them. Some of them is just LED light, and some of this is infrared light. It has been proven over and over and over again that certain wavelengths of light can actually stimulate, dropping stuff all over here, can actually stimulate Angiogenesis can actually stimulate cellular reproduction. So especially in those capillary beds that are close to the surface of your skin, we can use light therapy to help improve angiogenesis in the tissues. Now, another thing that you can do is you can do pulsed electromagnetic field therapy on your extremities, right? So this is using an electromagnetic field that's pulsed. It's not the same as the EMFs that come from like high tension wires and the incandescent light bulbs, like the CFL light bulbs that you have in your house. Certain types of electromagnetic fields can be actually very harmful to you, but a pulsed electromagnetic field, the right frequencies, can actually help improve nerve function, can actually stimulate nerves. Your nerves need a lot of exercise, if you will. They're very much like muscles. In order for them to improve, they have to be stimulated. Vibration to those nerves can be helpful at generating new nerve activity and improving blood flow to your nerves. Pulsed electromagnetic field therapy, as I said, the light therapy. Don't forget those supplements I told you. And then absolutely 100%, if you're a diabetic, you've got to keep your blood sugars under control. Now get this, insulin is like a blowtorch on your nerves, right? So, pardon me, insulin's like a blowtorch on your nerves. Inflammation, the word inflammation comes from the Latin word that means to ignite. So inflammation is like having something on fire. How are you going to rebuild nerve tissue if it's on fire, right? If there's inflammation, you can't rebuild that. You can't build a house while it's burning down, right? It's impossible. So you've got to reduce inflammation. And if insulin is inflammatory, guess what's going to happen to your nerves? That's right. They're gonna be damaged potentially from the insulin. Hi, Pam. Hi, spinal cord stimulator. Spinal cord stimulator is could be good for pain. Sorry, I'll get back to what I was saying. It can be good for pain, but it's typically not going to stimulate those peripheral nerves down in your feet and toes and whatnot in your hands. Okay, so the thing's called a rebuilder. If you look that up, there's certain types of electrical devices that can actually stimulate those nerves. You want to exercise those nerves. Vibration, even getting a clean, brand new, not ever used toilet brush and gently brushing your skin can help stimulate those nerves and cause your brain to say, hey, we need to regenerate that because this person wants to use them. We need to be bigger. Just like if I wanted to create a bigger bicep, we'd want to work it. You want to work those nerves. So we want to increase blood flow to the area, all right? If we're going to increase blood flow to the area and insulin and blood sugar and all that is destroying those little microcapillaries, we're going to have to reverse that somehow. The L-acetylcarnitine, sorry, I'm saying that wrong. Acetyl-L-carnitine, the vitamin E, alpha-lipoic acid, all your B vitamins. 10 unit can be good, sometimes not the right frequency, but some of them have different frequencies that can be helpful. But it does stimulate the nerves. There are frequencies that can work better than that, but 10 unit's a good place to start. Remember I said all your B vitamins. Check your nitric oxide levels. Go on to Amazon, get a little bottle of nitric oxide test strips, test that, get some supplements that can help increase your nitric oxide. It's going to be good for your heart and your vessels. It's going to be good for your nerves. We want to reduce inflammation. We need that inducible nitric oxide, the stuff that's made when you get inflamed. We need that to be low. Okay, so you want to get inflammation out of your body. Not completely, but we want to get the most of it out of there. And most of it, I hate to tell you, is going to come from your diet. All right, so watch your diet. Eat a good, clean, healthy diet. You want good, clean meats. You want, actually, funny enough, you want some good saturated fats in your diet, like coconut oil, olive oil. You want some good saturated fats because your nerves, you see all this? Let me show you this here. If you look at this nerve right here, it comes down, and then it has this little yellow tip on it. That's actually the nerve fiber. All the stuff around it is something called myelin, and that myelin is made from cholesterol. If you don't have that covering around it, your nerves are basically going to short out. You need healthy levels of cholesterol in your body. So there's lots of things you could do. Do not just sit around thinking that there's nothing you could do about your diabetic peripheral neuropathy. There absolutely is. If we can be of assistance to you, there are a lot of therapies in our office that we do. We do the light therapy. There's class 4 laser. There is Hakamed microcurrent therapy, pulsed electromagnetic field therapy. We have the best unit on that in the market. That unit that we have in our office, you're not going to buy for your house, I could tell you, unless you are completely wealthy. It's about $35,000 unit. So, but if you want some help with these things, I promise you, in the research, it shows that you can fix this problem. All right, provided the nerves aren't completely dead. And it pisses me off, sorry for the poor language there, it pisses me off that there's all this research, study after study after study after study, pages of studies that show that your nerves can actually heal, but you have to get to the cause. You have to do things that are going to change it. And in Lyrica, with all the side effects from it, should be banned for the treatment of this. I understand it can give you relief, and I'm not here to take away the relief you're getting. But with all the side effects that come along with it, it's almost like, what are we trying to do this for? You know, typically Lyrica, by the way, in the studies shows that it really only helps the symptoms for about a year before they start returning, and then it's very hard to even take doses high enough to continue to handle the symptoms as your body gets used to that medication. So let me know if you thought this was helpful. I appreciate the comments. I'll try and get back to some of these this afternoon. I see some of you. I'll try to get back to you all this afternoon. I appreciate you watching. As always, the thing that I ask is that you share this so some people that are out there suffering might have some hope that they can get better. If there's anything we can do, let us know. Give me some little hearts, little likes, and don't forget to hit that share button. Really appreciate you. Have a great day. I've got a lecture to give tonight. We're going to talk about stem cell therapy. It's another way, by the way, we didn't talk about that, helping regenerate those nerves. They are neurogenic in nature. Stem cells have been shown in research to actually help improve nerve function because they can help regenerate new nerve tissue. I have a patient right now, came in with neuropathy actually last week. And on his 3-week follow-up, we did some stem cell injections in his feet. And he said it's the first time he hasn't had pain in quite some time. And really, really happy. He's actually back. Now, I don't know if this is a good thing or not, but he's actually back to driving because he can feel the pedals in the car. He was so scared of losing his independence and moving around and falling. And now he's actually just doing fantastic. He's back to driving, drove himself to the appointment. 3 weeks, folks, 3 weeks. So things can be done. Give us a call, Magnolia Medical Center. Our number is 615-225-9100. Or you could just message us here if we can help you in any way. Take care. Enjoy the rest of your day.